Hello! Today we're going to be talking about autonomic dysreflexia, or what we call AD, Part 2. Before watching this video, please take the time to watch our video on autonomic dysreflexia, Part 1. Please pause and read. In this video, we'll specifically focus on what to do if an AD episode is occurring and know the options for managing AD. We'll also review prevention strategies. What should you do if an AD episode is occurring? First, make sure that you sit up. Raise your head so that you're at least at 90 degrees if possible. Loosen any clothing and take off anything that you're wearing that might be tight or being worn for compression, such as an abdominal binder or compression socks. If you can, find and remove the cause that may be causing you pain below your level of injury. Most commonly, emptying your bladder can help resolve an AD episode, checking your clothing, making sure nothing's too tight, nothing's bunched up, and then, if needed, going through a bowel care program to make sure that you've eliminated your bowels. If you can find the cause and remove it, your blood pressure should return to normal within minutes. But if it doesn't, please call our outpatient clinic at the Nielsen Rehab Hospital if you are a patient receiving care from us at 801-581-2267. If you are unable to reach us or not a patient at the Nielsen Rehab Hospital, if you are not receiving care from our outpatient clinic and you cannot reach them, please immediately call 911, as this is considered a medical emergency. Another option is to use nitrobid ointment to treat autonomic dysreflexia. It is best if this is administered with oversight from a medical provider or with previous training from a medical provider. That being said, I will review the steps here. Make sure that you wash your hands with soap and water and then put on gloves. Make sure that you have the application site clean and dry, free from hair. Typically, it will be placed directly under the collarbone. In some cases, it might be placed on the upper back, and so making sure that those areas are free of hair. The applicator is just a little card that has a line on it measured in inches, and it'll show you exactly how much to apply, and then you spread a thin layer, and you don't actually rub it in, you just press it onto the skin, apply tape, and make sure that it's secured in place. Then you'll monitor blood pressure, and then when it's time to remove the medication, because the blood pressure has returned to a normal range or your baseline, you would once again wear gloves and use either a wet washcloth or a wipe, and wipe away the nitrobid and make sure that you throw away those gloves, and then monitor your blood pressure for the next 4 hours to make sure that everything is stable. If there's a failure to remove the nitrobid, your blood pressure could become dangerously low. And this is something that we want to avoid, because then we will have the opposite issues with a low blood pressure episode. We love prevention here at Nielsen Rehab Hospital. So things you can do are be aware of what your blood pressure is. Have a blood pressure cuff available to you at home and monitor it regularly. Here in the hospital, we will take that blood pressure throughout the day, and we have a pretty good idea what your new baseline blood pressure is, but it is helpful for prevention to keep an eye and be able to monitor that. Also, if you're feeling symptomatic, you can easily measure your blood pressure at home, and we recommend that you would bring this blood pressure cuff with you when you're out in the community. Follow your bowel and bladder schedule, so making sure you're doing your daily or every other day bowel care. If you're intermittently cathing, making sure that is happening on a regular basis and that you're not allowing your bladder to get too full. Wear loose-fitting clothing, so nothing that's too tight, nothing that's going to dig into your skin and possibly cause your body pain. And always adjusting your clothing after transfer, and making sure that your compression garments, if you're wearing them, aren't getting bunched up and causing pressure. Educating your friends and family. So have them watch our video series or read the chapter in the Yes You Can manual on autonomic dysreflexia, so that they can help recognize when an AD episode may be occurring and help you know what to do. You can also carry an AD card, which we highly recommend. This can be found in the Paralyzed Veterans of America Yes You Can manual, as you can see a picture of it here. It is also available on our community resources website, a link to their wonderful manual. Here you can pause and take a picture of the AD card that we recommend you having with you. We can provide a hard copy of it as well. We highly recommend having this so that in case of an emergency, if a first responder is assisting you, if they're unfamiliar with autonomic dysreflexia, as this is very specific to spinal cord injury, and it goes through the steps 1 through 10 of exactly what to do and how to help you. The key takeaways are that AD is considered a medical emergency and it can be life-threatening. In many cases, AD can be managed at home, but if you are unable to get your blood pressure to lower and you cannot find the cause of the AD, we definitely want you to seek medical attention. There are many causes of AD, which you can learn more about in our Part 1 video. And once the cause is identified and removed, your blood pressure should return to normal within minutes. Thank you so much for watching. If you have any questions, please contact your healthcare providers. Have a nice day.